Good afternoon. Today I'm going to explore a broader aspect of bipolar disorder with some approaches. I have to say that this illness has become very important and valuable to me because I have a best friend who was recently diagnosed with the illness after losing a child to a violent boyfriend. Um, some people simply view bipolar disorder as a person's change in mood, but it comes along with a lot more aspects. I want to start off with what is bipolar disorder, essentially, because it's not just my change in mood. But according to the American Psychiatric Association, bipolar disorder is essentially a person's brain disorder and their changes in mood, energy, and ability to function. And that's what starts me off with the different approaches that are said to cause bipolar disorder. The first approach is a psychoanalytic approach, which is said to cause both the manic and the depressive moods that go along with bipolar disorder, and they come from low concepts of yourself and the feelings that you have. And next is the trait emotion that goes into bipolar disorder, that says to go from the maniac to the depressive stage. The maniac is something that goes along with a lot less sleep within a person, and depressive is when a person needs to have a little more increased need of sleep. Next, there is the biological approach, which says that high or low levels of neurotransmitters such as dopamine and serotonin cause the aspects of bipolar disorder. Next, there is the humanistic approach, which says that when aspects of life stop, then this is what causes a person to have bipolar disorder or develop disorder in a sense. Next, there is the behavioral and social approach to bipolar disorder, which says that this can be learned, I guess, from family or what you see, in a sense, and it can be unlearned. Next is the cognitive approach, which says that bipolar disorder comes from having too much medication come along with your illness. And this is what takes me to my next stage, which is about a lot of different famous people that have bipolar disorder, including Demi Lovato, for once, who was diagnosed with bipolar disorder after having to stop using drugs So her diagnosis of bipolar disorder comes along with more of the humanistic approach. And then there's another person, Chris Brown, in a sense, who goes along with the trait approach of bipolar disorder, which is more on the maniac side. So the fact that he was not developing a lot of sleep caused him to have changes in mood and energy. And this shows a lot of the facts that you can be anyone in life, essentially, and develop bipolar disorder, not just because of your mood, but because of the different approaches that go along with it. So, thank you so much, and I really appreciate my work here.